Hello, this is an instructional video on how to use the BHTi anchor removal tool. This tool, as you can see here, is a pistol grip tool. There's an outer shaft and then an inner pincher shaft feature. What you're trying to do with this instrument is you're trying to get these little pincher features to, or at least one of them, to go underneath a small shelf feature on the head of the BHTi anchor implant component. So what you're going to do is, this is your implant, these are the anchors fully deployed. You're going to go down and you're going to try to locate the pincher so that it will engage the undercut of the anchor. This is easiest to do when the anchor is fully deployed, so you can have the anterior face of the implant to sort of butt up against. So here I can kind of tell that I am engaged with the undercut, and it'll be easier to tell once you start squeezing because it will grip underneath. So I'm squeezing and pushing on the removal tool. It has gripped the undercut, and now the outer shaft of this instrument is going to push against the anterior face of the implant as I pull on the instrument trigger. So I'm pulling, I'm pulling, I'm pulling, I'm pulling, and then I release, and the anchor has become retracted. I would repeat that on the other anchor if both anchors are fully engaged. Before you try to remove the entire implant, you would want to check fluoroscopically to make sure that the anchor is fully removed from the vertebra. If it's not, you would want to further remove the anchor. You can try to use the removal tool to grab onto the anchor, even if it's partially retracted. Say this is partially retracted. This is a little trickier because you do not have the anterior face to sort of align you or be a backstop, but it is possible to kind of grab the anchor undercut in space like shown, and you would just, again, push off against the anterior face. You can also give it a tug even if you're not pushing off against the anterior face. The removal tool is a little trickier, again, if the anchor is in space. So at this point, if this is sticking out a little bit, using another tool, like a plier-like instrument, may make sense as well. And you should be able to toggle and tug the anchor out after it's at least partially retracted to remove the implant. And that's it.